All right, here's a question for you. Feeling a little stressed at work? Well, for the first time, the World Health Organization is recognizing professional burnout as a medical condition. They say burnout not only has a significant impact on your health and how productive you are, it also costs the U.S. healthcare system nearly $5 billion a year. For more now, I'm joined by Dr. Michael Stanton, clinical psychologist and assistant professor of health sciences at Cal State East Bay. Thank you so much for being here. This is a really important topic. Tell people at home what exactly job burnout is.
So, burnout in terms of the ICD-11 that just came out, they define it more as, number one, exhaustion, number two, depression, negative mood associated with the workplace, and then number three, a diminished ability to perform your work duties.
And so how do you recognize if this is in fact burnout or if you're just having a bad day at the office?
Yeah, there are some really interesting exclusions in the diagnosis. So number one, the ICD-11 is one system that's used internationally. The DSM in the United States is more common. It hasn't really recognized workplace burnout in the same way. But I would say that number one, if you're experiencing negative mood in a variety of scenes and situations in your life, that might be more likely to be depression or related to anxiety. Whereas if it's specifically in the context of the workplace, that is going to be closer to that.
So once you leave the office doors, once you leave work behind, you feel an immediate sense of relief, then perhaps this is more professional burnout.
Exactly.
Okay, so how do we manage? I mean, we've all got to work. How do you manage the workload without, making yourself crazy? So
that's a great question. I think that number one, making sure that you have limits on your work. In the current climate, there are a lot of pressures to make us work all the time, at home, wherever we are. And I think it's important to really make sure you have time away from work as well. Community is really important. The research shows that having a source of community both at work, support from your supervisor, and having support at home are very protective in terms of workplace burnout.
I often hear from people it's important to get some physical activity. Do you see that as a potential remedy as well to job burnout?
Absolutely. I'm glad you mentioned that. Where I actually did my graduate work, Duke University, they have a lot of research showing that physical activity has actually very much the similar effect as antidepressants, except without many of the side effects, and it works incredibly well.
Okay, let's say though that we do increase the amount of time we spend at the gym or on the hiking trail, but we still get this burnout effect. Then what do we do? Is it time to look for a new job, or is it time to have a conversation with our supervisors? What do you think?
I think it's important to have a good advocate for yourself in the work setting. For sure, if there are some problems, it's not necessarily the alarm bell to run out the door, but sure talk to your supervisor. A lot of workplaces have ombudsmen as well, or human resources people that you can chat with. Maybe even check in with a coworker about whether they're feeling something similar as a touch point, and see if you can manage some of that stress by limiting work hours, physical activity. Diet is also very important. And then if that feeling still continues, that might be a sign that it's time to look for a new job.
Maybe time to make a change. Doctor, thanks so much for coming in and talking with us about this again. First time that the World Health Organization is in fact recognizing job burnout as a real medical condition. Thanks again. Appreciate it.
Thank you.